The paper I'm going to present today is on dietary vitamin D3 deficiency alters intestinal mucosal defense and increases susceptibility to Citrobacter rodentium-induced colitis. So some background on vitamin D. Vitamin D is a fat-soluble prohormone. A prohormone is simply a hormone that needs to be broken down or altered before it is active. So you can either produce vitamin D yourself through exposure to UVB. So the sunlight comes and converts a steroid compound in the skin, and it converts it to cholecalciferol. Another way is through eating certain foods, such as fish, so you can get it through your diet, or you can get it through dietary supplements. This will enter into the digestive tract, and through passive diffusion, it'll go into the body if it's a supplement, or it'll go through D-binding protein, and it'll be transported to the liver, and then eventually to the kidney, where it'll be converted into calcitriol. Calcitriol helps stimulate calcium and phosphate ion absorption. Many people are deficient in vitamin D, so looking into vitamin D is very important. Vitamin D is not always associated with calcium. It also has implications in the immune system. It is associated with increased risk of infection. It can activate the innate and adaptive immune system, and it can also act as an auto or paracrine factor. Before I go into my presentation, there are a couple of cytokines that you need to know in order to understand the presentation. Cytokines are simply signaling molecules of the immune system. TNF-alpha, or tumor necrosis factor alpha, produces systemic inflammation. Interleukin-1 beta is a pyrogen. A pyrogen stimulates the fever response. It's also associated with inflammatory pain sensitivity. IL-6, IL-17A, and IL-17F are all associated with inflammation. IL-10 and TGF-beta are both anti-inflammatory cytokines, so they're doing the exact opposite of what the cytokines above them were doing. The purpose of this paper was basically to find the impact of vitamin D deficiency against C. rodentium in intestinal response. They specifically looked at the cecum, which is a part of the digestive tract. So they looked specifically in this area because that is where C. rodentium attaches the best to. The methodology that they went through. So first, they did their experiment on mice. They had two separate groups. Vitamin D3 sufficient group, which they had 1,000 international units of vitamin D3, and a vitamin D3 deficient diet, which contained 0 vitamin D3. Then they infected these mice with C. rodentium. Then they collected the cecal tissue and quantified the total RNA using nanodrop. They then reverse transcribed the RNA, and they reverse transcribed specific cytokines, which were the cytokines I had listed in the previous slide. And then they did a quantitative PCR to see the level of cytokines that were present in the tissue. Now we're moving on to the results. This figure is figure 5. We are looking at all the acute inflammatory cytokines that they were looking at. So that was TNF-alpha, IL-1 beta, and IL-6. Then if you just take one graph, the left-hand column says uninfected, so that's the control, and the other one is D10PI. D10 means the sample was taken on day 10, and PI was post-infection. So that's our experimental group. And then if you look on the x-axis, it says VD3, so that's vitamin D3, and DEF is deficient, whereas SUFF is sufficient, and then the CR is the C. rodentium, which was the bacteria that we infected them with. So looking at this, and any one of these graphs that you look at, all the uninfected rats that are vitamin D deficient already have a higher level of inflammation cytokines than the rats that had sufficient amount of vitamin D3. If you look in, so you'd be looking under the control column in each one of these graphs. So this is interesting and a very surprising find. So even without the infection, they have a higher amount. So now we're going to take a look at figure 6. This is a pretty big figure, so we're going to take it part by part. If you look at part A, it's set up the same way as the previous graph, and it's saying that there's an increase in IL-17A and IL-17F in D3 deficient mice. If you look at it closely, let's just look at the control. So that's going to be the left-hand side. So the vitamin D deficient mice have actually a higher amount of IL-17A and IL-17F than the vitamin D sufficient mice. So this is basically saying that there's kind of a higher inflammatory cytokines present, even without an infection. And that's seen in the yellow and red circles. Now let's transition into B. So for part B, we're looking at anti-inflammatory cytokines IL-10 and TGF-beta. So remember, the anti-inflammatory cytokines are doing the exact opposite. So you would assume that there would be lower amounts of this because there's just so much inflammation in the mice. But that's not the case. The vitamin D deficient mice actually have a higher level of IL-10 and TGF-beta than the vitamin sufficient mice. So this is seen in the green and blue circles. So this is maybe perhaps to try to fight the increased inflammation that is being seen. So just a summary, in vitamin D3 deficient mice, there's more inflammatory cytokines. And there's more inflammatory cytokines even when there's no infection. So there's overall just a higher background of inflammatory cytokines when the mice are deficient in vitamin D. There's also an increase in IL-17A and IL-17F in vitamin D3 deficient mice. So overall there's more inflammation. There is also an increase in IL-10 and TGF-beta in vitamin D3 deficient mice, and it's not seen in sufficient mice. So this is perhaps to try to fight off the inflammation that's occurring due to other cytokines. So, in conclusion, vitamin D deficiency leads to exaggerated inflammatory responses, and that could lead to a loss of commensal microbes. So basically, this inflammation is killing off the good bacteria as well, and it impairs the host's defenses. So my discussion questions are, number 1, why is inflammation so bad? Inflammation is supposed to help the body get more nutrients and get rid of help the body get rid of its infections through recruiting immune cells. But why is it getting this bad rap? My second question is if there is a loss in commensal microbes, what might be the effect on the rat?